This week marks 3 years since the World Health Organization officially declared COVID-19 a pandemic. Since then, more than 1 million Americans have lost their lives to the virus, and we're still averaging about 2,000 deaths every week. But protective measures have largely disappeared. Even some hospitals here in New York are no longer requiring masks. And that's a serious concern for people at high risk for serious illness and death from COVID. ABC's Brad Milkey, host of the Start Here podcast, joins me live now for more on that. Brad, you spoke with a disability advocate, Stephanie Tate, about these easing restrictions. So what is the biggest concern here for people at high risk?
It was a really interesting conversation because you look at somebody like Stephanie. She's got a pre-existing heart condition, kidney condition. She also takes a medication that suppresses her immune system. So not only is it easier for her to get a virus than the average person, it also would hit her harder if she got the thing. And yet she goes around at this point into her local grocery store. Fewer people are wearing masks, right? Even at her local pharmacy, no one seems to be wearing a mask. No one seems to be protecting each other because a lot of people in this country, we've sort of decided, like it's time to move on, as if COVID is not rapidly circulating amongst the population when it still very much is. And so to somebody like Stephanie, even though we're living, the last year has been the fewest deaths of this pandemic, she actually feels less safe than ever before because she doesn't feel like there's anyone besides her. And a lot of disability advocates feel this way. They're sort of the only ones acting as if COVID is around them.
Now, Tate says that she feels like we're living in 2019 rather than 2023. What does she mean by that?
Well, she says, by what metric would you think we're living in a post-COVID world? Like, everyone right now seems to be like, we're post-COVID. Back in the pandemic days, past tense, she's like, what metric makes you think that we're out of this at all? Is it that fewer people are dying? Because, okay, we've got, almost 2,000 people dying just last week. That would be several 737s falling out of the sky every week. I mean, that's what that would mean. If that was happening, if a 737 was crashing every day in this country, we would say we still have a severe flying problem. And yet, we've all kind of accepted that, oh, this is like the baseline amount of death in this country. And so, she says if you look at cases, they're almost meaningless numbers because not as many people report their test, not as many people test at all. And so by any of these measures, she says it's very difficult to convince yourself that we're not just acting as if we're in 2019.
So how do advocates like Stephanie respond to people who say, at some point we do have to move on, right, and if you're concerned, you can wear a mask, but hospitals, everyday people can't mask up forever?
Yeah, she says it's a legitimate question. It's one she gets all the time. So one-way masking, right? Which we know works to an extent, right? Especially N95 masks, these high-quality masks, they will protect the wearer very effectively. However, she says, when you're talking about a crowded environment, indoors, not that much ventilation, that's a lot of responsibility to place on one person's mask if that person is at high risk. I also asked her about, hey, you had these sort of conditions before COVID was a thing, right? Like it would have been risky for you to walk into a place with the flu.
Right.
Are you saying we never should have, we all should have been masked up always to protect someone like you? And she said, I do think that the pandemic taught us that we should have masks in hospitals. I actually thought that was kind of encouraging that would help somebody like me. Great, let's keep that. We're not keeping that in a lot of states in this country. She also said, the flu is not COVID. As much as we all try to convince ourselves that hey, we're moving on, it's just another thing there that we've always had to deal with the flu does not kill like this. The flu does not maim like this. And we still are learning about the sort of the long-term effects of COVID. And anything else she says is kind of wishful thinking.
So what's the solution?
I mean, the solution, she says, would be masking in public transit settings and health settings is a big deal. And by the way, the CDC is still asking people to do this, right? Just because your city or your state says you don't have to mask on public transit, the CDC says that's still a really important thing. She also says masks would be less of a thing, less important, if more building management at offices, at event spaces, installed better ventilation and had HEPA filters, these things that clean the air constantly. That would actually make a big difference for that one person. At this point, somebody who's wearing a mask, they either have a medical condition or they know someone who does, and that would make a big difference to that person.
Now, this is personal for you. So how are you and your family navigating this?
Well, I should say I've seen this up close because my wife, at the beginning of the pandemic, was diagnosed with lupus, which is an autoimmune disease. And she had to start taking medication that suppressed her immune system in the beginning of this. And so just in the last year, I've seen this as well, where it's extremely frustrating for somebody like her to go on a subway with me. We'll be the only two people masked. And to think, at this point, a mask is almost a flag to her of being like, oh,
something's wrong.
This person feels the need to wear a mask, and to see nobody change their behavior is very, we've gone to weddings where, we're sitting by the door masked, an open door just for the extra ventilation to make sure that she can't get sick right now.
Right.
And then to have an employee come by and be like, oh, there's a draft, we got to close the door. It's extremely isolating, and it's almost a signal, and I've seen this up close to somebody like my wife or somebody like Stephanie Tate, where it's like, a lot of the public would just rather you be gone. Would just rather you kind of like keep your problems somewhere else. And that's actually why the mental health of a lot of these disability advocates has been one of the most frustrating things, to feel like, do I even want to reintegrate into a society where people appear not to care about me? Where I think Stephanie Tate said, where it seems like people would rather get their bloomin' onion or go to a party than to spend an extra few minutes thinking about me. And I think that's the thing that I think as a country we're gonna have to recognize.
And I know in the episode you unpack all the different angles on this and different solutions that aren't necessarily everybody masks up forever. So it's such an interesting episode, Brad. I also, before I let you go, want to touch on another one you explored, completely different topic, the WWE.
Yes.
They're trying to make betting easier, but these matches are scripted. How does this work?
Think about this. Think about if you could bet on a WWE match. So many fans, it would be so exciting. There's so many great plot twists. And there are reports right now that the WWE is going around to state gambling boards saying, hey, can we make this legal in your state? But the thing is, they're all scripted. We know that the WWE is scripted. It's famously scripted. In fact, we speak to someone who used to be like the ringside reporter at WWE. She now works for ESPN. She said, we all had the script like a day in advance. So what they're trying to do now is they're going to give the wrestlers less time of knowing who actually wins their matches. They're going to try to lock in the bets, perhaps, because this is a big deal. We talked to a sports betting analyst who said this is not just about WWE. This is a big moment in sports betting because this could expand it to all sorts of scripted content. Betting on The Bachelor, betting on American Idol. Like, all of these things they're legal in some places and there are low limits on these things, but sports bettors have been saying for years, if we can get non-sports fans betting in this environment, that's gonna be a big, big deal.
All right, Brad Mielke, interesting stuff. I have so many more questions. We're going to have to leave it there. We're going to have to tune in to the Start Here podcast. You can hear Brad dive into all of these topics on Start Here. New episodes drop weekdays at 6 a.m. Listen wherever you get your podcasts.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.